Hello everyone, my name is Zainab and I'm a cardiorespiratory physical therapist. It would be the most difficult situation for a parent to witness their child having symptoms of COVID-19 or even be admitted in a hospital. Through this video, I would like to help educate about special considerations that should be taken when a COVID-19 patient is a child of less than 12 years. A few facts based on current research to mention are that children of all ages are susceptible to the COVID-19 virus. Most at risk are premature babies because before birth, during 24 weeks to 36 weeks of gestation, alveolar ducts or air sacs are developed in these babies. So a premature baby less than 24 weeks is at highest risk. For this reason, the most important thing is prevention. Hand hygiene is extremely vital as transmission to a child is usually through family clusters. Symptoms of COVID-19 in a child include fever, fatigue, cough. This can later be manifested as a condition called pneumonia. In pneumonia, simply it's fluid built up in your air sacs in the lungs. When this results in enough oxygen not able to reach the blood circulation, this is called acute respiratory failure. This can lead to further consequences of septic shock, heart failure, and multi-system organ failure. For this reason, it is extremely important that respiratory physiotherapy techniques are performed on the child during hospital stay and taught to the parent to continue even after hospital discharge. For treatment considerations, if your child is old enough to do breathing exercises independently, you can refer to the previous video on deep breathing techniques. The video link is also added in the description. To ensure that the child does the breathing exercises regularly, you can engage them in play or teach the exercise as a game. When I treat children, I usually use a scarf or a ribbon around their abdomen and try to tell them to breathe in as much into the abdomen to push the toy or scarf out to ensure diaphragmatic breathing. For a strong exhalation, I ask them to take a tissue or any cloth and blow as hard as possible so that it flies up, and then ask them to cough. You can try different ways to modify it so that the child doesn't refuse to do the breathing exercises but actually looks forward to it. During distress, children often use their upper chest muscles and breathe rapidly, like this. This leads to breathlessness. By placing them in a head down position and placing a towel roll or a pillow under their chest, like in the picture, you can reduce this abnormal upper chest breathing pattern and cause some relief. Another way the head down position helps is just imagine this is your body and you can see the top part has air, the bottom part has water, and this is your head facing downwards. Now the water represents blood. This means in the front part of your body is where all the blood and fluid collects in this position. So there is more blood circulation in this area and there would be more gas exchange within the lung. This would help in better oxygen perfusion. You can use a number of exercises on a gym ball or an exercise ball that can help promote trunk stability, which is beneficial for breathing, and it gives sort of an extension-like posture. This is termed as neurodevelopmental techniques or NDT. You can start by placing the child on a gym ball, holding their hips and engaging them in play until they stabilize on the ball. If the child is old enough, you can just hold their hips and not their upper body, and they can breathe in and lift both their hands up, breathe out and bring them down, and other activities like that. Also, you can place the child in a head down position and hold their legs and both their arms this way in the picture, and you can ask them to deep breathe or do any other different kinds of play. You can also ask the child to place both his or her hands behind the head, fingers interlocked, while you support the hip and legs, and they can breathe in, raise up, breathe out through the mouth and relax. During social isolation, to reduce anxiety in your child, You can even teach them some medication postures like in these pictures and teach them how to do deep breathing. One of the most beneficial is the bottom picture, where you can ask the child to place one hand on the chest and place one hand on the abdomen. Breathe in through the nose and try to raise your abdomen like this. Breathe out through the mouth and relax. If your child has recovered from symptoms of cough and breathlessness, try to incorporate a lot of play activities to increase their physical activity and agility, like hoop games, holding hands in a circle, running around. Finally, I would just like to mention that all the techniques in this video are just a part of respiratory physiotherapy, and these techniques can safely be performed by a parent. But it is recommended that the child is assessed or examined by a specialist physiotherapist, preferably in person or through a telehealth or a tele-rehab session, where the physiotherapist can teach the parent and even supervise customized exercise sessions. Thank you for watching. Stay home and stay safe.